So I'm here in Dubai in the United Arab Emirates, where the world comes to dream big, innovate on another level, and make things happen. And I mean, in healthcare, we need a lot of big thinking right now. So new ideas and groundbreaking innovations, because we've got a lot of problems to solve. So I'm here this week in Dubai at Arab Health with over 110,000 other people visiting from 180 different countries. So here in this special feature episode of the Talking HealthTech podcast, we're going to cut through some of the grandeur and spectacle and really get to the crux of some of the trickiest problems in healthcare, as I talk about the state of healthcare innovation with thought leaders, decision makers and experts from here in the UAE, Saudi Arabia and the rest of the GCC. So come along with me as we find out how to bring the future of healthcare to our world today. Collaboration starts with the conversations in HealthTech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
Hi, so I'm Dr. Louiza Chitour. I'm actually from Algeria originally, so I'm not very familiar with the region. Yep. Been here 9 years. And I like to call myself as the ecosystem architect in digital health in the region.
Yeah. Tell me a little bit more about what that entails, being the ecosystem architect.
So I actually am a pharmacist by trade. So I was very much into that boring part of the industry. Yeah. But then I really was attracted to how tech can really change how we, design healthcare, how we bring technologies closer to the patients and to actually address their needs. Tried to do that in corporate, didn't really work out. So I ventured into starting my own business with an Australian, actually, software engineer. So we did like this video game on type 1 diabetes. And that's how I met Plug and Play. And Plug and Play is really that household name in terms of accelerator and early stage investment. And they were just about to start their health vertical here in the region. And so they actually asked me to start it. And that was a startup in itself because it was really working with the government here. Imagine a regulator commissioning something related to disruption, tech disruption. Counterintuitive, especially right in the middle of COVID. But I believe it was the best and worst time to do it.
Yeah.
Worst time because obviously pandemic, scary.
A few hurdles there. But
exactly.
And that's really important in itself when you've got this space of in an environment like healthcare, which needs to be highly regulated and a lot of rules, but we're in a situation where we need new thinking and innovation and different ways to do things, which I imagine the startup ecosystem can bring. So having those two work together is what we need.
Yeah, absolutely. And I think, more the secret, I would say, for startups is really to engage as early as possible the other side. Because what I've noticed is that these two words don't necessarily communicate. You have great tech conferences where all the startups are there, all the investors, no doctors, no patients, no regulators. And then you have other conferences around health and innovation that feature basically no startups. Yeah. So it's I was trying to we need to bring those two words together because you cannot now anticipate a delivery of a healthcare service without tech.
Yeah, absolutely.
Less and less. So, yeah.
Yeah. I'd love to learn a little bit more about the particular geographical region. So was it in Dubai, focusing on UAE? What are the startups doing in this region that excites you?
So it's quite a nascent startup ecosystem, especially in healthcare. I think, We were more famous in developing copycats of like in e-commerce, in mobility, like the Careem is the Uber, is the regional Uber, and actually acquired by Uber. Then you had Souk, which was the copycat of Amazon that was acquired by Amazon. So there is a trend there, exactly. and I think what they brought, and I think the same philosophy applies to healthcare, is like, okay, we get inspired by what's happening elsewhere technologically, but then we contextualize it to patients here, to problems here, to the systems here, to how we pay for a service, how we access it. So I think listening and creating solutions that are, born here for patients here is the way to go.
Yeah.
So I realized I didn't answer your question related to the geography.
Fascinating though.
But it's basically, we started out in Abu Dhabi, which is the capital of the UAE, because Dubai is not a country. It is an emirate, contrary to popular belief. But UAE is really part of a larger region called the GCC, the Gulf Council Cooperation Council, which is essentially Saudi Arabia, Kuwait, Bahrain, Qatar, and the UAE. And this is kind of forming a new market, and it's like, gaining traction, and investments are coming here. There is like a whole movement from governments here to change the way they do things across sectors. So that's why we started out in Abu Dhabi, but we operate across the UAE, and then we scaled into the Saudi Arabia, which is a huge market in terms of scale. So I think that's the interesting thing about this region, is looking forward.
Yeah. We were chatting at one of the networking things last night. One thing that you said kind of stuck with me was that something a little bit unique about the region, if I understood correctly, was that typically within healthcare, one challenge that you might face is, I guess, having the convincing the users, the clinicians, to adopt technology in the first place. But you mentioned that we're a little bit more ahead here in the UAE. Is that about right?
Yeah, because I think, again, it's the demographics that are like composing the ecosystem. So you have like a lot of expats. You have also a very young population, and that very young population is digital native. Yeah. They are constantly, engaging virtually with their friends, with their co-workers. Most of the business is done on WhatsApp. I literally close contracts on WhatsApp. Send me the PO, and it gets done this way. So that's why the attitude towards technology is different. So I would say the challenge would be more onto understanding the landscape, understanding that it is a different one. So it's what does the patient look like? What are his challenges here? The same. What is the clinician's workflow here? And how can I help that clinician do a better job? So.
Yeah, and contextualizing for the market, that makes a lot of sense. You were moderating a panel last night at one of the events prior to Arab Health, and that was really great. You had a good mix of panel around the investment space and what needs to happen to fund some of the innovation. I think a little bit of focus around longevity and others too. What did you walk away from that particular session with? Any kind of key takeaways that might be interesting?
So the key takeaway, and it was interesting to see the diversity of the panel, because you had the sovereign wealth funds from Dubai Future District Fund, which is mainly focused on investing in MENA-based startups, mainly the UAE, but also anything in North Africa and Middle East. So kind of, because the impact needs to be twofold. One, on the technology scalability and financial ROI, but also job creation. It's a very young region that needs to tap into other sources of income than oil. So there's a whole, and the same goes for NEOM and in Saudi. So how can we push the youth here to create, so that they create new jobs, so that they are self-reliant? So the philosophy of investors here is quite different, especially when you talk about sovereign wealth funds. And then you have emerging VCs who think like other VCs in other regions. And I would believe that here they still struggled in the beginning with a smaller deal flow, or a smaller critical mass of startups to invest in. Yeah. But that is, this trend is correcting itself, because a few are taking that leap of faith and becoming entrepreneurs themselves. Those are the key takeaways. Government is heavily involved here. And it's not stifling, it's actually enabling innovation and investment.
That's important, yeah. And do you find that given the size of the market then, do you find that startups that come from the region are solely creating for the healthcare system within the region, or are they building with global in mind? Because that's something that a lot of Australian and particularly New Zealand technology providers need to do as well, is that the size of the market is only so big, so you need to think global the same as well.
I would think that it's becoming more and more the norm, because like there was a whole confidence issue or like complex of, I'm too small, I am not the American entrepreneur, because we all have this idea of US founders building, global solutions. So here and even Europe, we tend to look at like the environment where we're in or where we're based at to build a solution around that. But like, again, because of that youth, because of their exposure to founders that made it, that got acquired, that went global, IPO'd, there is increasingly this, confidence that they can build scalable solutions that can go beyond MENA.
Yeah, absolutely. And lastly, then thinking about, we've got a bumper week of, networking with people and sessions and understanding healthcare in the region, but globally as well. What excites you most about the future of this, and what are some of your priorities in the work that you do over the next 6, 12, 24?
One of the key most exciting things about is really to see startup scene continue to emerge and continue to increase in sophistication in terms of the solutions. Yes, we started with the Me Too products, but I want to see more of specifically designed solutions that come from here that are scalable outside, to give that confidence to founders. And it's all about knowing your market. There's a lot of entities here that have lots of physicians, lots of potential entrepreneur wannabe that needs to be encouraged. So that's what I'm excited about, particularly in the region. And it's a bit boring, but personalized healthcare, longevity is going to be the talk of the town. AI, obviously, enabling all of that. So I'm personally excited to see but what is the clinical reality of these technologies? How can we ensure adoption? How can we ensure that it doesn't create additional burden on the people that are already facing massive problems?
So firstly, can you introduce yourself, tell us who you are and what you do in the space?
My name is Meshari Alwashimi. I am the founder of Amplify Health. And what we do at Amplify, we're a medical technology company based in Saudi Arabia, where we combine thermal and hyperspectral technology with computer vision and AI, so we can detect diseases early. Essentially, amplify the human senses of clinicians to be able to see things that they couldn't see with their normal eyes.
Oh, excellent. And so would you put this in the category of, so early detection kind of falls in this space of prevention a little bit, I guess, jumping on an issue before it becomes an issue, which is something that we're all very good in healthcare, is addressing someone when they're sick as opposed to...
Absolutely. So in our case, the first problem we're tackling is diabetic foot complications. So every 20 seconds, sadly, we've been speaking for about 40 seconds now, 2 people around the world have lost their foot. So what we do is whenever someone gets diabetes, they have to get tested with their foot. We need to do a foot test. It's not being done around the world because there is not enough experts that can do it. So what we do with just a simple image, will be able to screen and detect those things, to be able to intervene early, because sometimes it becomes too late the moment it's diagnosed. We want to come in early, prevent it, focus on wellness instead of illness, essentially.
Yeah. And tell me a little bit more about the technology. You mentioned AI is involved, but thermal imaging, did you say? What's the...
So thermal imaging, essentially, just like radiology, radiologists read images from X-rays or MRIs, while thermologists read images from thermal images. The beauty of thermal and hyperspectral images, they detect the rays that come from you, or they will be able to detect the heat that's coming from your body, and that produces interesting signals for detecting certain conditions.
Yeah.
Think of blood flow. As the blood flow increases or decreases, that generates heat that can be translated into conditions.
I see. And so it's a device?
It is essentially a device that plugs into your phone or sits neatly on top of your camera. It's like a camera. And some smartphones already have thermal cameras on them.
Oh, interesting. And is there a software element that kind of ties into it as well?
And that's where Amplify comes in, is that we bring in the software and the knowledge from thousands of images that be able to detect if there's a condition in this person or not by comparing it to our data set of images, and also additional calculations that we do and invented in collaboration with top thermographers around the world.
And so you mentioned, focusing on diabetes in particular, and big issue globally, or particularly chronic disease, and that has a burden on the system. You're based in Saudi, right? Tell me a little bit more about this problem that you're solving. Is it something that's particular within your region, or are you taking a more global approach?
Absolutely. So I was actually based in Canada and the US before that, and now I'm back in Saudi Arabia. So I've had a nice global view of tackling digital health challenges around the world. Diabetes is one of the biggest. About a quarter of the people in the region have diabetes. Globally, it's a massive issue that continues to get worse. Unfortunately, people's eating habits are not the best, and we're doing better now of changing that. But in addition to the eating habits, with the sedentary lifestyle, a lot of people are still working at home or sitting on desks. We're not moving enough, and that's exaggerating or increasing the prevalence or the problem of diabetes. So it's a global issue. We're starting with Saudi Arabia, moving it to the region, and then we'll move globally with it.
Yeah, excellent. What I'm learning is that healthcare and business in Saudi Arabia is quite unique compared to other parts within the region. Is that right? Tell me a little bit more about the uniqueness there.
So I'll speak about the uniqueness from a digital health perspective. So we have something called the Virtual Hospital, or the Innovation Enablement Center. It's centered within the Ministry of Health, and what they do is if there is an innovation, they bring in different partners from the Ministry of IT, all of other supporters from NIH and the Saudi Arabian FDA and others to come in and support that innovation. Work closely with it to see how can we bring this to market as fast as we can, so we can learn as fast as we can. Because if we wait for a very long time, it could ruin a lot of innovations. So that's a nice environment that didn't exist a long time ago, but it's an excellent opportunity to come in and introduce solutions through that to different hospitals within the region to test it and improve it faster.
Yeah, that's something I'm learning, sir, because I know in healthcare, we're very good at taking a long time to do things, and unfortunately. So, and also we've got all the different stakeholders that need to be involved too. And particularly if you're an emerging technology or a startup coming through, to have that support and the different tools at your disposal, be it regulatory, be it, I imagine, distribution, all the other bits and pieces to get the business in place. I imagine then that's beneficial at a system-wide level, because a lot of these problems need innovative thinking to be able to bring them through, which comes from those earlier stage organizations as well. Right?
Absolutely. So they come in, and it takes you a long time as a startup to find, okay, this is an organization that's relevant to us, or a hospital that's relevant to us. How do you go and speak to them? Who do we speak to? How does the conversation go? So it takes a very long time to do it, but leveraging these collaborations, you'll be able to find the person and the answer much quicker than you would if you went on your own. So that's one advantage. Yeah. And in healthcare, it's typical and it's normal that it takes longer than other technologies, because if you make mistakes, it could cost someone's lives. So we need to be very careful when we introduce it, but there is many new ways now that are allowing us to test and try new technology in a safe environment that will not harm the patient.
Yeah, excellent. I was lucky enough to catch last night at one of these earlier events before Arab Health here. You were moderating a panel on a topic around longevity, obviously close to the topic that you're speaking about here. Tell me, were there any key findings or takeaways from that session last night that you walked away with?
So the key sessions is that the four main basic lessons that we've learned when we were kids, we need to continue to learn and continue to do. Exercise, eat well, sleep well, and avoid stress. And then how can you use technology to help you on doing those? There's a lot of new technologies that come out to help support you in all of these ways, help support you in understanding how diet is impacting your physical activity or your life and so on. So follow these four basic principles. Look at technologies that already exist that can support your behavior change to do that. But after all, clinicians and doctors and everyone can tell you so many things that you have to change, but if you don't want to change it, you will not do it.
Yeah, that's right.
You have to start and convince yourself that, okay, it's time to do a change. Then you can go and do these tools. But there is a lot of options and resources online that can help you do all of these and hopefully live longer and healthier and happier.
Absolutely. That's one thing I was thinking last night, are a lot of these discussions around longevity and what we need to do. And we all know that we need to exercise more and to sleep better and to not be stressed. If it was easy, we would have all done it by now. I feel like healthcare plays a really important role in that, but potentially it's a bigger social issue that maybe is too big even for this discussion here. But are you confident in the role that healthcare has in influencing this kind of change at a population level? Like, what gives you hope about, these messages that are easier said than done, that we might actually see some traction in the future?
But they are easier said than done indeed, but you can see just look at the type of diet people are eating. And you can see the pop-ups and the new restaurants that are coming. People are eating healthier, people are eating more greens. That's changing at the population level, so it's great to see. And then the moving places, the gyms are busier than ever before. So it's good to see that, and to continue the message, continue to support, continue to push the new generation to adopt this and make it part of their lifestyle. I think it's critical.
Yeah,
it's all about behavior change.
Yeah, absolutely, and something about the technology being working behind the scenes as opposed to getting in the way of good quality care, and that's certainly come through in some of those discussions we've had recently. For you then, looking forward, there's looking into 2024 and beyond, the work that you're doing within your organisation and within the system too. What can we look forward to seeing from you over the next, and what's your focus over the next 6, 12, 24 months?
So from the 6 to 24 months, our technology will hopefully be on the market. It will be. We have exciting partners lined up to take it to market. We're at the final stages of getting the regulatory approvals, and then we'll be in Saudi Arabia and potentially here with some big partners as well.
Yeah.
So we'll bring that. Our goal is to save as many people with diabetes as possible, save their limbs so they can live happier and longer with a better quality of life.
G'day Tom, how you going?
Yeah, good.
Yeah.
Nice to meet you in person.
Real person.
Yeah.
Taller than I thought, but that's what they say, right?
You're uglier than I thought. Yeah. No, great to meet you finally.
Yeah. Nice to meet you.
Yeah.
And mate, there's more people here than I can count, and it's a huge day. We're really kind of not even halfway through Arab Health, and when you said it was big, I believe, right? But it's a lot. Yeah.
Look, I think we're very excited that there's more Australians here this week than ever, right? I think you're one of 60 odd companies, other companies that have come here, and I think for them to try and explain to them, you can't get the gravity and the size of this thing right until you're here. Yeah. So it's a lot even for me, and this is, I think, my 10th Arab Health or 9th or something along those lines. So it gets bigger and bigger every year.
It's a big one. And look, there's a full episode that explains who you are and what you do and how you think. But for those that don't know you, really quickly, tell us a bit more about why you're here.
So Thom Soutter, Business Development Director for Synapse Medical, who members of Talking HealthTech. We've had an office in this region in Dubai for, nearly 8 years now. So here this week, we've got clients here, we've got businesses over from Saudi that we do business with. So I think for us, it's connecting with old friends. We also have a networking series, which is, there's so many events this week, right? You've been to quite a few. We've hosted 2 events during this week as well. So it's the biggest week of the year. Yep. So I think for us, it's catching up with old clients, new clients, trying to finalise a few contracts. Yep. And we've got our Aussie leadership team in town as well this week, so that's always nice. I mean, we catch up maybe 1 or 2 times a year, right? So it's nice to see people in person.
Well, I mean, I've spoken to Margaret plenty of times, but I just realised I haven't met her personally, in person either, so that's great to be able to do that. You touched on the networking piece, which sometimes, at these types of events, people might go, I need to do the networking and, tick the box. But what I've learned already, particularly in this region, those relationships are great. If you want to get stuff done, having those quality relationships that might take a lot of time is really important.
Yeah, I mean, I think for us, so we had the Australian delegation at Dubai Science Park where our office is, and I was trying to not, scare them, but it's we've just closed the deal recently, for example, that we've been working on for 4 years. And I'd like to think that's not because I'm a terrible salesman or because our products are really bad or because, we're not a business you'd want to partner with. No. It's just things take time. They want to see, everybody wants to come to this, the glitz and the glamour, but they want to see feet on the ground. They want to see commitment to the region. They want to see that you can solve pain points for them. Because I think if you think historically, there's been a lot of companies here that have been burned by people coming in, trying to make a quick buck, the recession crash, everyone left, all that. So it's, it takes time. Relationships are key. I think the one thing that's great if you do know people that have built those relationships is you can tap into it, right? Yeah. And if someone comes from a recommendation that's trusted, people are open to that. So it's open for business, but I'd say tread carefully and make sure you're willing to come back and follow up. Nothing gets done this week, right? I mean, look at it. Look at it. It's when does the work actually happen? It happens in the follow-up after this. So it's,
And something when we were at Dubai Science Park, and you provided a great overview to the Australian companies there about it was almost some of the lessons you've had. You've spent a lot of time within the region and made a lot of mistakes, and what is it, kissed a lot of frogs?
Yeah,
stuff like this.
I love that.
But it's I wasn't aware of how much paperwork and the licenses and the boxes you got to tick and all of that. You kind of have to have someone to help you through that process.
Yeah, I think a lot of people mistakenly think that, we've got a great product in Australia. We're going to come here, we're going to plug and play, we're just going to slam that in there, everyone's going to love it because, we work with X in Sydney or we work with X in Melbourne. It just doesn't work like that here, right? You've got to come, you've got to suss out, there's loads of different business parks, there's loads of, is it, private, public, government, where are you going to go? Where do you see your office being positioned? Are you going to partner with a local? Are you willing to give up some equity of your business to do that? Have you worked that out? So I think for us, like you said, we were quite open. It's coming to fruition in the last few years, and we've done a lot of work here, but we did make some mistakes. We were naive, and I think we'd openly admit that because there's not the infrastructure then that there is now. And talking about people like us, it's an honour to speak to the Australian companies because we can say, well, look, learn from us, right? And everybody's trying to pass that baton back, really, because the more Australian companies here, the better, really. He says with an English accent.
It may as well be Australian.
Yeah.
But and I've learnt a lot listening to some of the sessions, this morning in particular, hearing about how, something along the lines of the first 50 years was about, is within the region are going to be quite different to the next 50 years as well. There seems to be a lot of excitement and interest about investing in innovation within the area and building on what's happened so far with the region. Seems quite exciting.
Yeah, look, it's a really exciting place to be. I think here in Dubai, it speaks for itself. You've got Saudi as well, and things are changing there so much in terms of, regulations and things that can happen in terms of the speed of business. I think, look, in the last 50 years, I think this morning, because I was in that session too, it's built the infrastructure. Look at what they've built. Even just look at this, right?
Yeah.
The biggest health conference in the world. Biggest buildings in the world, biggest everything in the world, right? And then the next 50 years are going to be about how do they nurture and manufacture that talent pool and also what they're offering from here rather than just bringing the best of breed in. How do they make sure that the best of breed's actually being fostered here already? So the visas have changed. You can now get golden visas. You can get things which mean, you couldn't retire here previously. For example, because if you're an expat, once you no longer had a job or employment and the insurance went, you left. Whereas now they've changed that if you've worked your whole career here, as some of the people you've met this week have, then why should they not have the chance to retire here if that's what they want to do? They've got friends, they've got family, all of those things are changing. So I think it's exciting. Yeah. And hopefully you guys will be back, right?
Absolutely, we'll be there next year. But you mentioned Saudi as well, and I wasn't, we're coming from outside of the region, just, you kind of look at the Gulf and go, okay, well, I'm going to understand that region. Very different to the UAE.
Yeah, very different. I think the best advice that we can, although, changing and trying to now, I think there was a competition previously, whereas now there's quite a lot more collaboration happening. And I think with Saudi, I think it's just important that you have the right advisors, you have the right partners. To do business there, you need a presence on the ground. That doesn't mean that you have to set up your own entity. You could have a partner. But yeah, and I think there's a conference now in Riyadh, the Global Health Conference, which is basically almost mimicking this.
Yeah.
So that's another big flag in the healthcare ground, for things. So yeah, it's changing rapidly.
Yeah.
Rapidly.
Absolutely. And so we've still got another busy couple of days ahead, and you've done a great job in helping me connect with some wonderful speakers for this episode and just connect within the ecosystem. But what are you looking forward to getting out of the most out of the next couple of days?
So we've got some quite key client meetings coming up, which is great, especially when I've got some of the other Australian management team in town. We can meet them together, which is always good. There's a wrap-up drinks party, I think, with the smart young things of healthcare, I think that WhatsApp group's called, which I've said to everyone this week. None of us are smart and none of us are young anymore. But yeah, that'll be good to end the week because I think a lot of people here are going through the same things, the same excitement, but the same pain points in terms of length of sales cycle and those things. So it's always good after a week like this where we can all get together and debrief and have a chat about it. And I think as you're finding yourself, it's a very open community. So yeah, catching up with friends new and old, I think, for the next couple of days. Yeah.
And for Synapse Medical as well, it's looks like things are going strength to strength and building a good global footprint, it seems. Where are some of your priorities that...
Yeah, look, we've had some great approaches this week as well. I think the priorities for us, we've got some key announcements coming up in Australia, here one in the UAE that we're hoping to announce before Ramadan, which is coming up. And then obviously we have the national project in Saudi, which concludes in the next few months and then see where that goes. So kicking a few goals, as you say, in a few different jurisdictions, and open to see where that takes us. So I think it's a big growth year for us.
Absolutely. And if you were to then put a cap on it, then I think you've already touched on it, but for those organisations that are listening to this, a lot from Australia, but other parts of the world too, it sounds like the message is definitely open for business within this region, but find those right partners and do your research a little bit more.
Yeah, absolutely. Look. Use us, for example. We have the Advanced Health platform. Yeah. We've been here before. Speak to people that have been here before, whether that's on the regulatory side, the company formation, just companies that have trodden the path you want to go down. And I think those support networks are here now. Like it used to be a bit of a minefield, even just to try and understand how to get visas and all. It's not now. Ask the right people, tap into the right networks, and you'll find that people are willing to help. So yeah, I'd say it's very much open for that.
My name is Marwan Abdulaziz Janahi. I am from Dubai, born and raised, and I'm currently the Senior Vice President of Dubai Science Park.
Excellent. Tell me a little bit more about Dubai Science Park. Got a wonderful presence here within the exhibition. I was lucky enough to go and visit and get a bit of a tour earlier in this week as well, but tell me a little bit more about Dubai Science Park.
Excellent. So Dubai Science Park was an idea that was born in 2005. And the idea was to create a biotech community for companies. So it was a very broad idea that the Prime Minister at that time launched. And he basically assigned a group of people, including scientists, business people, and investors, to come up with a roadmap to make it happen. Now, I joined 1 year later, and there was, a couple of ideas on the table, and there was, an argument on what is the best way. Is the best way to invest in basic research and to do it from bench to market, create a fund, create guidelines for research, etc. Or the other idea was to go to the market, speak to the companies who have services and products, who are able to go into the market immediately and launch their company and their product. And I was from that team. Since I have a business background, did not have the science background at that time. So I was more leaning towards, doing it from early stage is very risky. We don't know much about it. Let's do it. Let's go the market way. Let's see what are the issues that the market is needing, what kind of services are required. And the region was growing, increase in population, increase in healthcare spending, so it was the right time. Luckily, that idea was approved, and basically we then said, okay, if we want to do that, then what is it that we need to do and what do we need to invest in? And we said that, there is a certain value chain that the science industry goes through, from R&D to manufacturing to logistics to marketing. And our idea was that let's create facilities that can cater to each and every step, whether you're someone who wants to do R&D or someone who wants to manufacture or someone who wants to do logistics and storage, or someone who has an idea and wants to do marketing. So hence our assets or facilities were around those things. And we obviously started, with the hardest, which was the laboratory building, because that was also a way for us to say, we're very serious and we're doing something that is quite unique. And at that time, our laboratory building was, the only commercial one in the region. There was lots of lab buildings used by, companies or governments, but not offered to commercial companies. So that was quite unique. That was in 2009, and that's when we started operations. So, 4 years after the idea. And then after that, we launched the warehousing or the light manufacturing units to allow repackaging, some services for more of the medical devices and the equipment. And the latest thing that we did, which we probably launched in 2017, was the commercial towers for offices, which I think is where you went.
Yeah, I went to that one. And that's interesting because I would have thought the not the logical way, but the simpler way, because as you kind of alluded to, might be set up a co-working space or the offices, because one might think, well, we've got an established product or business that we're looking to expand from another part of the world into the UAE. Maybe I just need a sales office or a representative within the region. But you're talking about, products being built from the ground up within the region. And I imagine then that builds a lot of trust and credibility and understanding of the market locally compared to just dropping someone into the region and trying to work it out.
Yeah. So we have also introduced a co-working space that we call D quarters or Dubai quarters. The idea was always to facilitate the entry to the market. Whether you're a one-man show, you want to take a co-working space and test the market or do a pilot, or you're a large company that wants to relocate 50 people to 200 people, or someone who wants to do manufacturing, or someone who wants to do research in a lab. So I think the diversity of offerings that we have is very, very strong. But also, I think one thing that I probably wanted to continue as well was that, it's not only about the infrastructure, it's also about the connectivity and the network and the community. That to us, I think, is very, very important. And it takes probably 50% or more of our time is to connect with the existing partners, do events like Advanced Health, participate in events, connect with universities, with the government, and really be able to connect the dots. And that has given us a huge power to not only understand the sector, but also know what are the opportunities. How do we, where is the next company coming from? Is it Australia? Is it India? Is it the US? What are the connections that we need to make? And how do we facilitate that?
Yeah. Well, that's seeing some of the initiatives like Advanced Health and the others that you mentioned too, that's really struck a chord with me, looking at the number of people coming into the region looking to do business or make connections, and even you just see it at an event like this, it can be overwhelming and difficult to get started. And sometimes there's only a couple of dozen key people that you really need to have a chat with to be able to get the ball rolling or understand the market a little bit more. So that sounds like one of the most important things for an organization that's looking to come in is find those trusted partners early, because it's not just about those connections either, is it? There's the licenses and all the kind of nuances of setting up a business in the region that I imagine you've kind of got all that covered as well.
Yeah, luckily we were able to, not only provide you space, but also to take you through the licensing process of setting your company. So you could be a one-man show, a company that is owned by an individual, or a company that is owned by a corporate entity somewhere else, or even a branch of a foreign company, in a free zone setting. That really makes things much easier. But then we've gone one more step further, which is the community and the connectivity. And although we don't claim to be experts, but we understand many things about lots of things, and that gives us the opportunity to connect the dots and make meaningful connections, because the success of that company will automatically result in our success, and that's eventually what we want.
Yeah, absolutely. And I guess building on that too, that's evidenced by your presence here at the event today. There's a number of sessions that we've seen that, sharing content with the rest of the community and bringing together experts. And you've done a great job moderating a lot of those sessions as well. So you've obviously got a good understanding then about what are some of those key themes and the topics, and what are the biggest problems to solve, or the biggest opportunities within the region. I'm hearing a lot of longevity. I'm hearing a lot of the focus on preventative health. Where do you see the biggest opportunities, and what excites you about healthcare in this region?
Well, healthcare is going through a huge transformation, and I think that's the exciting part. One of the parts is that it's going through a massive digitization, and secondly, it's also going through lots of rationalization. There is lots of fragmented facilities. There is lots of hospitals who need to kind of be put together and be rationalized. And I think the glue for that is digital. So digital is definitely one key area. But at the same time, there is also opportunities in personalized medicine, whether it's stem cells, whether it's biotechnology, doing research and clinical trials is also becoming more and more relevant because of the diversity that the UAE has. Although, we're a small population, but, very, very diverse. So how do you, take advantage of that and extract as much information as possible? And, there are many areas, to be honest, and it's very difficult for me to pick because people who are in devices, they see, opportunities. People in pharma, even generics, right? People think generics is boring and old, but look, there is a shift to that as well to reduce the cost of healthcare. I mean, not only the UAE, but even the bigger region, whether it's Saudi Arabia, whether it's Egypt, and Dubai is this really, great small place where you can prove something and then grow from here, So, and that gives you the confidence, it gives you the access, and also, if you can't do it in Dubai, then where else?
That's a good way to put it. A health tech innovator or someone trying to create some new solutions within healthcare, they need to be aware of the regulatory hurdles or the nuances within particular regions. And the vibe I'm getting from speaking to people and listening to sessions is it actually seems like quite a, you need to understand, the nuances and the regulatory environment, but there seems to be quite a dynamic approach that's taken towards laws and regulations that if something's getting in the way, there's the opportunity to let's address it and let's actually try to achieve something else. So how do you find that regulatory market within Australia?
Well, it's always been like that. And, I think there is a very clear approach and a clear mandate that we need to facilitate businesses and we need to facilitate the growth of companies. And everyone adheres to that in a very nice way. And as long as you are, wanting to improve a process or wanting to make a positive change for a patient, for a system, then you would always have someone who would want to hear you out. You never get the idea or the vibe that this is the law and we can't do anything about it. It's more about what can we improve? Tell us about the benchmarks. How is it done in other countries? Why is it done in a certain way in another country and what can we learn from them? How can we do it better? So we kind of start from the end, if you will, which is a good advantage that Dubai has and the region.
Yeah, absolutely. And so putting all that in perspective, then if I'm in the shoes of someone from Australia or the US or India or somewhere else in the world looking to do business in the UAE or the broader GCC, the final kind of tips and bits of advice, and where should they start, and what should they maybe even have done before they even look to enter the market?
I mean, this advice can be a little bit tricky because it depends on the solution or the product. Sometimes it is the case that they need to come in with a partner, whether it's a distributor or another partner. Sometimes it's best to represent yourself. But from the 450 companies we've seen, and we've seen both cases. Some of them have done really well with a partner. Some of them have done really badly with a partner. And in the other side, some of them have done really well by themselves and also really badly with themselves. So it can't really be a blanket approach. But when you represent yourself and you're here talking about a product or a solution that you know absolutely everything about, there are less chances of things going wrong because there is no middleman or there is no buffer between you and the end user. So my advice is that start small and start with one person. You don't need to have a large, crazy office with lots of people. Eventually that will happen and we will all celebrate together. But start small, validate your idea, do a pilot, talk to the right people, make sure that you are aware of the regulations, and use people like Dubai Science Park who have these connections and have these networks. And sometimes, and the advice that I would give is that sometimes it would take longer than you expect. So always make sure that you have the patient, and it's never going to be from the first time or the second or the third, and you should always look into whatever interaction or experience you have as a learning experience. So what did go wrong? What went well? What went wrong? How can I improve?
Yeah.
And that approach, usually I've seen that it kind of works.
And there's something probably too in always the founder or someone that's really close to the problem. They're the one that's passionate and know what's at stake here. And so I guess there'd be benefit in coming out yourself to be able to share the vision and sell the dream, to be able to get those first kind of things in place so that you can expand the team and grow over the years. And I was just thinking, as you were saying that, lastly, we're back onto Dubai Science Park for a second. When I was at the facility, it was very impressive. And then I saw the plans for future expansion. I'm like, wow, there's even more on the cards. And I think I heard somewhere that it's only not even 50% utilised the full kind of capacity there. Talk to me about the expansion plans in the future. What can you expect from Dubai Science Park when I come back next year, perhaps, and then in years to come?
Yeah, well, lots of plans in the years to come. We are at almost full capacity in all of our assets, which is a good problem to have. But at the same time, we want to also make room for growth. Yeah. So we are expanding on some of those facilities. We have already launched our light manufacturing units, or the warehouses. Phase 2, it's actually under construction and hopefully ready by Q1 in 25. So that's something new that you're going to see next year. But we also want to expand on our other products. We launched our incubator last year in June, which is called N5 Science. And we already have about 12 companies. Some of them are being featured here. So we want to expand on that as well. We want to be able to provide more support and more services to the incubators because, as you know, they need to be given much more support than any other companies. Our co-working space was also launched last year, so lots of growth there as well. So really in all areas of our facilities, and obviously the community is getting bigger and bigger. We are very excited, obviously with the warehouse gym coming in the summer of this year, that will actually bring the community together. People will exercise together, so that's a nice thing to see. And in addition to the clinics that we have about 8 clinics, very diverse, from dental to ortho, pediatric, women's health, even mental health, physiotherapy as well. So we're very happy that we've been able to create a community, not only for a place to work, but also you can be treated, bring your family, exercise. So that's great, yeah.
So my name is Hinda Daggag, and I am a geneticist by background. I work in PwC as a healthcare director, as a consultant.
Yeah, great. Excellent. And so tell me a little bit more about the work that you do from the genetics and all that space.
Sure. So I have been studying genetics for about 10 years. So I have a PhD in human genetics. Which makes me kind of, I guess, a nerdy scientist to some degree. Although, people...
A nerdy scientist with a cool haircut, though.
Exactly. People don't associate that. But yeah, I think I am deep down inside. So I did my PhD in Australia, and then I moved to the UAE. I've been here for about 11 years now. I started in academia, but unfortunately slowly moved away from it and went more into clinical applications and kind of bringing the genetic research into the clinics and kind of, I guess, bridging the way between the two. So trying to contribute to both.
Yeah, interesting. Well, that's really important in an area like healthcare, having, evidence-based solutions that are addressing particular health issues. And in the area of genetics, genomics, personalised medicine, it's all a really exciting area at the moment. So I imagine you must be quite busy and focused right now.
Absolutely. I think, when I first started studying genetics, and this was more than 15 years ago, it definitely wasn't this popular, and there was a lot of stigma around it, and genomics was kind of utilized only in one way, which was to help people that are in need of that, to diagnose them with genetic disorders, basically. Right now, we have moved so much further, and I don't want to say away from that, but I guess expanded genomics applications and what you can really use it for and utilize it for has gone way and beyond just kind of indication-based testing. And we have moved into the space of wellness and I guess longevity as one of the buzzwords that you would have heard at Arab Health. So it's definitely an exciting time to be in this field.
Absolutely. And I was going to say that definitely the theme for this week has been around this area of longevity, yes, but we're constantly hearing around moving from sick care to proper health care, and also improving the the health, the quality of life, not just making people live longer. So tell me a little bit more about the application of some of the work you do in this interesting area around longevity.
Yeah, you're absolutely right. I think that's spot on. We are no longer just managing or diagnosing patients. So we are also actually moving away from that whole notion that this is something only that is used in hospitals. Now, a lot of people are very aware of their well-being, and they want to do better, and they want to feel good, and they want to be able to live longer but healthier. So I guess we are talking more about health optimization. And to put things in context, genomics, even though, for somebody like me, I want to think that is the only thing that matters. But realistically speaking, it isn't. It is a holistic approach where genomics and nowadays even multiomics, so like epigenetics and transcriptomics and proteomics, there are many different branches, of this field. So they are only one piece of that puzzle, because your genetic makeup, is not what fully makes you who you are. There are other elements that play a role, like environment, like your maybe circumstances, socioeconomic status, many different things. But, if you put all of these together, they give you a very, very powerful tool to really optimize individuals' health.
As you're talking about that, I'm thinking, that's great that there's a bunch of nerdy scientists working behind the scenes to be able to come up with the, and optimize and utilize this information. But to be able to get it in the hands of patients, what are some of those things that I might use as a consumer that then utilize some of this technology and the science that we might start to see enter into our healthcare system and also for lifestyle too?
So let me start off with some basic things that have nothing to do with genomics, okay? Like I sometimes when we think about longevity, or another buzzword is biohacking, which I quite like, but I think people sometimes misunderstand that actually the basic concepts are good sleep, good diet, exposure to light, things that are that are out there, that are really available for all of us. So it's a personal choice. So that's one thing. So there is something that all of us can do, because I think longevity and biohacking is being sold as for a specific layer of population, let's say, and sometimes it can be frustrating, but there are certain things, certain elements that are within the reach to all of us. Now, number two, when we bring it back to genetics and genomics, and what can we do in that space in order to really personalize the health approach to an individual? Yes, you do want to know their genetic makeup. These days, it's becoming more and more accessible and more affordable. So we are really very much so within that space where we're saying you can have your whole genome sequenced for even a couple of $100.
Yes.
So, I think that we are much closer to that point where we see genomics being integrated into your everyday practice and definitely into the routine clinical practice.
Yeah. Are there particular resources or sources of information that you'd recommend people check out to be able to learn more about this space?
Look, I think genomic information right now and learning about genomics field literally is everywhere because it is the buzzword. Now everybody wants to be in it, whether it's genomics, longevity. So whether they are big government entities, you will find information. Any sort of a healthcare provider. These days, also, if you go on their website, you will definitely find something about genomics. So really, the information is readily available. I think it is more about filtering that information and kind of understanding, what is evidence-based, what is really science, and what is not, what fits outside of that scope. And, just something that is kind of to give people more accessibility. PwC has done some work within that space. And the point of it is exactly what you're referring to, the information that is available for everyday individuals, lay persons also, who can actually refer to it. So on our website, you will find some thought leadership pieces. We've actually just today launched a longevity piece that's out there. We will soon, in a couple of weeks' time, I believe, have another piece that's within the genomics space. So I think whether it's PwC or any other similar companies, that is also their sources of information.
Look, it's great to be able to have that scientific backing, but then to be able to put it, as you say, in that layman's interpretation. So I'll make sure that's all linked up in the show notes for people to check out if they want that more information. Lastly, then, Hinda, we've spent a week talking about genomics, genetics, and living longer and having happier, healthier lives. There's a lot of people here at Arab Health. What would you hope that people take away from this conference and start to apply back into their own healthcare settings?
Look, I mean, if I'm being completely honest, I believe that conferences like these are a wonderful networking opportunity. So, obviously the focus is on healthcare and many different aspects of healthcare. We see that this year the theme has been quite a lot around longevity and wellness, because also there were a lot of talks about NEOM and what Saudi is doing in that space, what the UAE is doing in that space. But I think take these conferences as an opportunity to network, to introduce yourself, and to just get out there and learn about people and companies, that are in it.
Absolutely. And actually, one other question too, because, you may as well be called an Australian. You studied in Australia, so you know the area well enough, and you know that there's innovative health tech companies and also interested healthcare clinicians that might be looking to enter into the GCC, whether it be the UAE or whether it be Saudi or whatever. So any advice that you might give? It probably follows on a little bit from what you just mentioned around building those networks and building that trust and whatnot. But for those entering the market and trying to understand it a little bit more, any advice that you would give?
I believe that although the market is similar to other markets, it is also unique in its own way. I think it is very important to understand the Middle East and the GCC from an even wider perspective, as how the region functions and what is available right now. Obviously, UAE and Saudi specifically are really having kind of an accelerated growth within the space that we have been talking about. So I would encourage everybody to come to these sort of events, such as Arab Health, such as MedLab, and many others. And this is the perfect opportunity for them to actually learn about what exists here and how to navigate the waters.
Thank you so much, Peter, for this beautiful opportunity. My name is Mazin Gadir. I've been in the UAE for now 45 years. I actually came to the UAE when I was -2. I've been in healthcare for now around 25 years. I've been in digital health specifically in this region for the last 15 years, and I work for IQVIA now for the last 5 years. Originally, I used to be a quantum physicist with engineering background. I happened to see myself in healthcare, and I found out that healthcare is much more complicated than quantum physics.
Well, there you go. Well, but that says it all. I think anyone working in healthcare can relate. Maybe that fact makes them feel a little bit better. But I see every side event, every nook and cranny of this event. When I ask people who should I speak to for this episode, your name comes up as one of the top ones. So you've seen healthcare, particularly in this region, for quite some time, and you've lived here for even longer. Talk to me about that journey through like healthcare over the past 10, 15 years in particular, and where healthcare is at now in this region, because it seems like a really exciting time.
Absolutely. So I'll give you a story. You'll laugh about it. Yeah. My mother, when she was pregnant with me in 1978, she would have to fly somewhere to give birth to me, because at that time the healthcare system wasn't up to where we are now. Now, 3 of my kids, 2 of them are born in the UAE. I will not have it anywhere else. So in my lifetime, the UAE healthcare system, the GCC healthcare system has transformed and pivoted so many times. In the last 15 years, I've started with implementing hospital information systems with Cerner back in the days, moved to work in government sector on multiple journeys, amazing pivoting continuously, and amazing leaps of digitization, of innovation across the whole healthcare sector, from regulators to providers to insurance to employers. It's gone all out when it comes to transforming the healthcare system.
Yeah. And something I've noticed in my conversations too is that interplay between the different stakeholders is really important. And I think I've mentioned in previous conversations too that something that seems a little bit unique in this region is that, I guess, coming from my background as a if you're coming from the technology vendor's perspective, often you look at the regulatory environment and go, this is the constraints that we have, and it kind of feels a little bit deflating about, like, here's an innovative solution, but the regulatory environment doesn't allow for it. Whereas here it sounds like there's a little bit more opportunity for collaboration between those, that if there's regulatory in the way, it's not, that doesn't mean that, that's it. There seems to be a bit of a conversation that goes on there.
Absolutely. And I think you have to remember, our regulatory landscape is maturing up. Right. In the last 50 years of the lifetime of this nation or the nations around us, we've been focused on building infrastructure for copy-paste as much as possible, consume. Since COVID, this region has realized its powers, its energy is actually in building sustainable health systems with the leadership of the regulators. So the regulator understood their role, looked around for all the lessons learned from the other regulators around the world, and they found out that over-regulating will actually demolish your appetite for innovation. So there is some hint of deregulation around us, but with a close eye to watch where our innovation and digital health transformation is pivoting to, or what's the trajectory of our digital innovation in this healthcare system. So again, the regulators are not taking a backseat completely. In fact, on the opposite, they are leading. We have visionary leadership across the region. Don't forget, they set up strategies that are 50 years ahead of time, and they're looking at how to bring in the future of health to your doorstep. And that's challenged with challenging the middle management, challenging the authorities on a federal level, on a local level, to live up to that amazing vision.
And the vision seems clear, and it's almost like demarcated in that there was a lot of consumption building, or at least building things that now it's kind of like reaping the rewards of the work that's been done, and kind of really establishing a health system within the region that's can be world leading in particular areas. I've noticed in different parts, innovation coming out of this region does certainly seem to be ahead of other parts at times. From your perspective, what are some of the most exciting innovations you see that the region is particularly well poised to kind of deliver for the population within the region, but potentially also export to other parts of the world?
I think the most exciting innovation that is coming out of this region, knowing that this region is a diversity pot, right? This is a melting pot for over 200 nationalities, if I say the least, whether it's the UAE, Saudi Arabia, or Qatar, where you have a lot of people coming into one spot. That's number one. So the diversity is generating a lot of innovation from it when it comes to, for example, personalized medicine, or you look at the different types of diseases, whether you look at rare diseases, research, or chronic diseases that you need to look at. We have certainly a high prevalence of lifestyle diseases, the likes of diabetes, which begs the need for us to develop more and more innovation in the area of chronic disease and disease monitoring and patient remote monitoring innovation and track and trace capabilities. So I think this is a very important aspect that drives the innovation. AI certainly has taken us by a storm here, and every stakeholder in the healthcare ecosystem in this region is excited with the potential application of generative AI. The regulators are certainly building their regulation sandboxes to try and see and push the envelope with regulation, try to test the regulation. Just like you build data sandboxes, we are also building regulation sandboxes, because healthcare regulators know that they'll have to deconstruct some of the strict images that came out of GDPR or HIPAA. And now we're looking at obviously pushing the envelope. And COVID has shown us that healthcare is an investment. It's no longer a cost center. Healthcare is a national security of our presence and of our existence. And the sustainability of our economies would rely on how we can quickly innovate in healthcare, cutting time from planning to designing to testing and producing. So.
And it's in this environment I've learned of a region that's probably a younger population, I think slightly. However, the shift, much like other parts of the world, is that birth rates are a little bit lower, so which suggests then over a longer period of time, population will age. But the unique position that the UAE or the GCC has is that there's a bit of time to, at least we've seen in other parts of the world, be it Japan or the US or other parts of the world, that they're in this situation now. It almost feels like, well, there's this identification within the region. Well, now is the time to do something so that we can kind of get ahead. And so all these points around chronic disease and caring for the elderly, these all impact at a society level, not just at a healthcare issue as well. So it seems to be that thing.
Absolutely. Don't forget, lifestyle is one thing. As you mentioned, fertility rates are dropping, not as drastically as in Japan or other countries, China, for example, right? We have an issue of longevity, end-of-life care. New specialities are coming. At the same time, our region is embarking upon converting their health economies into research and sustainable economies, right? They want to figure out how we're going to live up to COP28 and the outcome of COP28 that came out in the last few weeks to try and build a zero net carbon footprint health economy. They're also looking at the longevity. You are dealing with public health concerns and emergencies now that are hitting our region from all different angles because of obviously the diversity of nationals and diversity of population. We have rare diseases on one side. This region is surrounded with no less than 2 billion people around us. Africa on one side, subcontinent India from the subcontinent on the other side. These populations are growing, as you mentioned, a high percentage of young population. However, you're always predicting the aging population. Now there is a huge drive for genomics and personalized medicine to try and understand where are we going with our population? How are we going to bring in healthcare to the forefront of our priorities in these economies, knowing that there is also a lot of conflicts happening around us. So mass migration is a reality of our daily life. So we need to understand how to actually develop healthcare systems that could actually be agile enough to absorb mass migrations, to absorb new different nationalities, to be able to incorporate more and more different ethnicities as well.
Yeah. So given this landscape and the context there for an Australian innovator like myself, if I've got a solution, or clinicians looking to expand into other parts of the world, advice for those coming into the region, from your perspective and what you've seen, what's that appetite like for bringing in new innovations from other parts of the world, and what would you say to those?
Oh, yes, I'll definitely advise you and invite you to come in. Number one, grow your cultural and social intelligence skills. That's very important because this region is based on trust and relationship, and has always been the case. The fact that you can build bridges of trust and relationships with the local communities, with the international expats who live here. When you come into healthcare, it's the same need. You need to be, number one, you need to explore your unique selling proposition and see how your product market fit would actually allow you to come in. You need to understand your partnership and collaboration and how you can collaborate with local players, international players who are residing here, as well as try to understand the needs. One of the best important aspects that I would advise newcomers, especially coming from digital health background, who want to bring their innovations here, is number one, is make sure that you do your homework by understanding the culture, understanding the needs, the health system needs. So not only the national culture, I'm talking about the health culture, right? Understanding the intricacies and the relationships between the different stakeholders, employers with payers, with providers, with regulators, and how the system is actually and changing and dynamically moving, so you can fit your product in the right place with the right partner at the right time. I think one of the number of companies actually have made it here, but they didn't have the patience nor sometimes the perseverance to invest in the region. So making money is going to be always your number one priority as a newcomer in the digital health space. But before you do think about the commercials, you need to think about the investments that you're going to make, the tolerance level. How long can you stay here without landing contracts? How long are you going to spend in building relationships? And then number three, what are the area that you will be addressing so well in order to collaborate and form partnerships for your ecosystem to be representative for your products, for meet the right clients and whatnot.
Yeah. Mazin, I feel like we could chat for a lot longer, but we've also got a networking session that we need to attend to. I appreciate you making time late in the day to have a chat. Thank you so much.
Sure. My pleasure. Actually, Peter, it's a pleasure to have met you, and I'm really excited that you're going to be visiting us multiple more times. I know Saudi UAE will be, you will see a lot of great conferences, a lot of great events. We have a lot of opportunities. Again, the number of startup accelerators, the community of digital health is growing, and I think it's an honor to have you with us, and hopefully come and visit you in Australia at some point.
So,
thank you.
So I'm Ahmed. I'm a pharmacist by education, and I currently work as a management consultant in healthcare. So I work in the healthcare field. I help organizations, governments, and public sector organizations, non-for-profits, multilateral organizations, work with all of those, and I help them become better. I help them transform. I help them serve patients and improve health outcomes.
Amazing. And so here in the UAE?
Across the region. So I've worked in UAE. The longest has been in UAE, but I've worked across the region in UAE, in Saudi Arabia, in Jordan, and Egypt.
Excellent. And so I'm learning much more about the region overall, and we might get into a little bit more about what you've done this week. But firstly, I'm curious about some of the work you've done, not just here in the UAE, and I'm fascinated hearing about some of the nuances and differences and I guess exciting opportunities in areas like Jordan and Saudi and things like this. Tell me a little bit more about, I guess, the dynamics of the region.
The region is so this is an interesting region. If you haven't lived in the region, you would have different impressions on the region. But once you live here, you realize that there's a lot of commonalities, a lot of synergies. At the same time, there's a lot of fragmentation. So commonalities come in the language. There is unity in culture. There is unity in weather, atmosphere, challenges, history. That really brings the region together.
Yeah.
People know and get familiar with each other quite easily. Challenges would be mostly in the regulations. Regulations, objectives, GDP, income, how countries make their income, basically. And that's pretty much it.
Yeah. And so then this week at Arab Health, I saw you in a few different places, but particularly at the DSB booth, we were going through a white paper as well that was launched this week. Tell me a little bit more about that.
Yeah, absolutely. So Arab Health in general is dear to me. Arab Health, I've been attending Arab Health for like almost the past 20 years, since I was still in school.
Oh, yeah.
Yeah, exactly. So it's great to see how it grew and became what it is today. It's massive, and everybody really, it's a destination. Yeah. What we did during the first day in Arab Health was launching a white paper that was written in collaboration with the Dubai Science Park. The Dubai Science Park is one of the private sector hosts of many companies in a sustainable manner. It hosts them in their premise, so they work from there. It helps them in logistics and setting up their businesses and running their businesses. But they've been doing a great job in shaping the healthcare scene in the UAE in general and Dubai in particular. The white paper was, it's been almost a year since we've been working on that white paper, and it's a great milestone to be launched during Arab Health. That's how it was envisioned when the inception happened for that paper. The concept was to explore what's going on globally, what are the mega trends that are affecting healthcare and changing how healthcare is being provided and done and executed globally. And what that means to the region. How does the region respond to those mega trends, and what really counts here and what doesn't count? Yeah, was a very interesting approach. We started with a scan to globally what's really changing healthcare globally, and then we started zooming in with around 18 local experts on those mega trends. We approach it like any other project that we would approach in consulting. So we've taken those inputs. We went through design thinking process. We co-created the concepts that would affect the region. Yeah. We explored what that means, and then we took the outputs and we did further analysis and research, primarily on the market to cross-check those trends in the region, in the market. We then started expanding the research to get examples and give this local flavor of it. So when you read the paper, you will see that there is an outlook to the trend. There is a deeper look on that trend. There are insights and examples, and then there is a specific chapter on each trend on what that means for the UAE, how it looks from the UAE.
I remember you going through the presentation, and I feel like that summed it up quite nicely, and I'll definitely be putting in the show notes of this episode the link for people to check that out in more detail. It has been a few days, I got to say, though. Like, remind me of some of those key trends. That there's the usual suspects that you'd expect in this current climate around AI, but I think it tied together quite nicely. Are there trends in particular, and you mentioned there's quite a few, but the ones that you'd like to call out in particular that are, I guess, worth being aware of, particularly if you're looking at healthcare innovation within this region?
All right, so that's a good question, and it has been a few days. It has been a few days. It's amazing that in those few days I've attended Arab Health. I flew to Saudi.
Oh, you just dropped in?
Yeah, flew to Saudi and done some work. I flew back in, done some work, and now we're sitting together. And that's what the region is about. The region is it's really small.
That's cool.
Yeah. All right. So the 5 trends are, I would say, the usual suspects to an extent. However, there are different ways to look at them. One of the major trends is healthcare shifting from being digitized to being smart. And you would see that in different countries. The main difference would be between digital and smart is that you have a digital tool versus a smart tool that actually gives you insights, and you can make decisions and actions and change outputs because of that. We've been witnessing massive digitizing within the region, where analog and old style hospitals are just becoming digital with the same old inefficiencies, with the same old processes, with no changes. Yeah. Not really helping anybody. In fact, in some cases, we find that digitizing hurdles the care process and makes it slower, makes it more inefficient. So the shift to become smart is something that has been observed recently in the region and still at the very beginning. And that was made prominent by COVID. Yeah. When COVID came, we were just caught off guard. And everybody realized that, yes, we do have data, we do have things in place, but we can't do anything with those. With this data and with those things in place. The good thing about the region here that the decision-making process in almost every country across the region is centralized. So when COVID hit, if you look at the examples from the region on how the region responded to COVID, it was all brilliant. It was very quick, very agile, in fact, during COVID, Dubai was almost open all the time. We've only had a lockdown for like 3 weeks.
Yeah, that wasn't the same in Australia.
I can imagine, especially Australia. I had a friend who couldn't fly back for months. Yeah. Only 3 weeks. We stayed home for only 3 weeks. And then they utilized the quick policy changes and the agility in policy change, the digital infrastructure that existed, and implemented lots of smart solutions that made it easy for people to move and go back to normal as fast as possible while COVID was still there.
Yeah.
The second thing that was really observed during that time was the opening of the Dubai airport. So it opened quite quickly, and they've remained open all the time. It hasn't closed again. So there were regulations, there were restrictions, there were very clear processes that you had to follow to fly in and out, but it was open. And that was very good for the economy at that time, that people flew in, they spent their times here and so on. So that's the first trend. Just a quick example of that.
Yeah.
Another trend, I will highlight 3 out of those 5. Will be I won't say the other 2 so that we can get.
Yeah, you got to download it to get it. I like it. Yes, do that.
The second one is really about research trends. Research, the region in research is still beginning. There is a lot of facilities, there is a lot of research facilities, and there is a lot of ambition and need for research. However, research has always been pushed upon the region and not generated from the region for quite some time. And again, back to COVID. It's redundant now, but back to COVID, that was really the engine that moved everything forward quite quickly in healthcare here in the region. We realized that we need to have our own infrastructure, we need to have our own protocols, our own independence when it comes to research and results out of this research. So you start seeing trends like, for example, the genome program in Abu Dhabi. You start seeing universities investing heavily in research, and trends that are coming in, resulting in things like, for example, the ambition to have an entire digital twin program for every citizen in UAE.
Wow. So
the objective is to have 1 million for the local population, 1 million digital twins.
That's quite progressive thinking, though. Like, we're looking at, like, I don't think we're having that conversation in other parts of the world. So that's really cool. I like that.
It is. See, the region in general, if you don't know the region, it's trendy. We like trends.
Yeah.
We like to do things that are flashy. The longest building in the world, the widest building in the world, and the deepest dive pond in the world, right?
Yeah.
So this is something that we like in this region. We can do it. We have the resources, the means, the brains, the funds for it. Why not? If you can be the best, why not be the best?
Love it. Love it. Yeah.
So that's another trend. We're looking at things like, for example, precision medicine, research on the N of 1, where research is done for you as an individual, on you with your genome, with your metabolic nature, to come up with precise medicine for you. We see this emerging in the region, and we see this coming up to be more observed in different places. The third trend, which the one I will close with, about the trends, is the sustainable healthcare. And sustainability is big here in the region. It's big for many reasons. The first is, in the past many years, healthcare has been funded primarily by governments. And that has proven to be unsustainable. It just keeps on increasing. And with what we're seeing today, with the current spending, which comes up to around 4.5% of the GDP in UAE, for example, which is quite good for the region, the gap is still increasing. There's more diabetics. There are more people that are experiencing cardiovascular diseases, and it will only keep on increasing. The other trend was aging. We're a young population. If you look at the region, we're a very young population. But that's changing because we're young, we're getting old. So there are more people coming older the next 10 years than ever before in the past hundreds of years. With that change, the cost of healthcare will increase. So if we can think of sustainable solutions and trends, we can sustain it. The second thing is that the region and the country here is quite keen to report positively on the ESGs and SDGs, right? They want to show that such a region that is heavily dependent on oil and the producer of oil can still be sustainable and green. And that's the second thing. So the first component is economic, the second is environmental, and the third is social. We have a very interesting social fabric here, and social sustainability of healthcare is an element that people are looking at to make sure that there is accessible care for everybody from different social sectors and social like backgrounds who can access equitable, good quality healthcare. So that's the triangle we like to draw, and we touch upon this in the paper on achieving sustainable, economically, socially, and environmentally sustainable healthcare.
Look, I feel like if there was someone coming from outside of the region looking to understand what's going on more, it seems sensible to be well informed, and it sounds like there's a great resource there with this white paper that's got a lot of work behind it to be able to understand some of those trends, and you can be well placed to find your place if you're looking to understand the market a little bit more.
Absolutely, yeah. So I would say that the white paper focuses more on the UAE market. It talks about the region, about the globe, of course, when it comes to mega trends, but it focuses on the UAE. It will give the reader a very good glimpse on what's happening in the UAE, what's the structure of the market, what's the size of the market, the growth that to be expected, and where to invest. It definitely, like any paper, it will leave areas for you to explore more and dig deeper in. One of those areas would be the regulatory framework and how to get into the region from a regulatory and policy point of view. And I think this is the point. The point here is to generate topics for conversation, for further conversation, and that's hopefully what will the reader feel after the paper.
Yeah.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.